Operations Center COVID-19 briefing for Wednesday, July 7th, 2021. I am Les Roy Williams. Thank you very much for joining us for our press briefing today. Of course, we continue to appreciate you joining these press briefings so that you can keep up to date with what is happening with the management of the COVID-19 pandemic here in the Federation of St. Kitts and Nevis. Of course, you are an important part of the management of the pandemic. It is not just those at the NEOC, it is not just the National COVID-19 Task Force, but all of us, we are involved in the management of the virus here in St. Kitts and Nevis. I want to recognize among us the Minister of Health, the Honorable Akila Byron Nisbet. I recognize the Honorable Wendy Phipps, the co-chair of the Disaster Mitigation Council. I also recognize the Permanent Secretary in the Ministry of Tourism and Transport, Mrs. Carleen Henry Morton, and I recognize also the Permanent Secretary in the Ministry of Social Development and Gender Affairs, Mrs. Janelle Lewis Tafari. Without further ado, I would invite to the podium Mr. Philip Brown, who is the Director in the Ministry of International Trade, but today he is here in his capacity as the Director of the SBDC, which is the Small Business Development Center. Mr. Brown.
Thank you, Mr. Williams, and good afternoon to all. Ever so often, we hear persons repeating a most common and perhaps overused statement, referencing small businesses as the engine of growth for economies the world over. This is normally uttered when such persons are seeking to attach a level of importance to small businesses and the activities of the micro, small, and medium enterprises operating within that sector, the MSME sector. Sometimes, however, one is left to question whether persons using this adage is simply showing their excellence in the use of the English language and the delivery of a great speech, hence the engagement in an exercise of self-aggrandization. While the real answer to my question may never be known, this COVID-19 pandemic is now causing me to insert some of my own old sayings, well, using some myself, which our parents and grandparents would have repeated over and over without fail. Firstly, we would have always heard them say, "Who in the kitchen feel the heat?" Then closely related to that, we would hear them with "Who feels it knows it." Clearly, we in the Federation would have over the past year witnessed firsthand, up close and personal, the importance of small businesses, which constitutes the micro, small, and medium enterprise sector. We would have seen how this sector is relevant to real life and livelihoods, in fact, people's ultimate survival. We have become aware over the past year of the significant number of persons who are directly employed in this sector, hence their ability to provide for themselves and their families. Yes, we have seen and felt the pain of loss of income, which impacts our self-esteem, and self-worth, hence eroding what would have been otherwise a comfortable or good standard of living. It is in light of this that we, at the Small Business Development Center, SBDC St. Kitts, within the Ministry of International Trade et al., seeks to ensure that though we may have endured some loss, that we would not have lost the lesson. As such, we are admonishing you, our entrepreneurs, and small business owners to take control of your ability to rebound from this challenge, embracing the new norm, especially where your implementation and continued adherence to what is now the new business protocols are concerned. These critical practices and procedures are now the inevitable and can almost be considered in the same vein as your operations blueprint and your business continuity plan. These protocols, inclusive of the wearing of masks, sanitization of persons moving in, around, and out of your business's physical operating space, the maintenance of physical distancing, and recording of persons entering are all simply a part of the new business operating environment, as is the recording of your daily transactions and the collection of your payments, etc. Additionally, COVID-19 may have brought some good lessons and forced business advancement by way of us adopting what we refer to as best practices. As such, therefore, the use of electronic platforms for activities such as marketing of your products and services, receiving orders, collecting payments, they are all good things and is a positive development which can certainly lead to further business growth and development. In light of the foregoing, therefore, and as we seek to continue to assist you, our entrepreneurs, with the development of your business plans, the sourcing of incentives and financing, general business counseling and training, etc., let me once again assure you that SBDC St. Kitts stands ready and is focused on ensuring that you can take advantage of the positives as has been outlined by reaching out to our technical support team via the following electronic platforms. There's www.facebook.com SBDC St. Kitts, or that would be SBDC SKB. So I'll do that again. It's www.facebook.com/SBDC SKB. Email address sbdc@gov.kn. Via WhatsApp 869-669-3358 or 869-661-7648. Yes, we too have made the necessary adjustments to ensure that we can continue to serve you, our entrepreneurs, in a seamless manner in this changing new normal times. Thank you very much.
Thank you, Mr. Brown. I now invite the Permanent Secretary in the Ministry of Transport and Tourism, who is here in her capacity today as the chairperson of the Transport Board, to address us.
I would like to adopt the protocols that have already been established. Good afternoon, everyone, those present at this afternoon's briefing, and to all those persons who have tuned in via radio, TV, and the internet. I am here to make a brief presentation in my capacity as chairperson of the Traffic Safety and Public Service Drivers Board, commonly known as the Transport or Traffic Board. The board understands that the public transport sector is a very critical one. More normal times, it is responsible for the safe commute of thousands of citizens daily as they go to and from work and to attend to other facets of their lives. In the era of COVID, we have equally a responsibility to ensure that the welfare of commuters and operators is afforded an extra level of priority and vigilance. The board therefore welcomes this opportunity to lend our voice to ongoing calls for increased coordination and cooperation in this sector to control further spread of the COVID-19 virus. As we are all well aware, tomorrow, Thursday 8th, and the following day, Friday 9th July, will be limited days of operation in the Federation, when citizens and residents will have the opportunity to move around to replenish food supplies and purchase essential goods and services. The limited days of operation are not intended to be a free-for-all. Rather, it is expected that we will move only if we absolutely have to. It is expected that we will all act responsibly to prioritize what we have left home to do and to strictly adhere to the COVID-19 prevention and control measures at all times as we go about our business. With that said, I want to make a special appeal to all persons providing public transport over the next 2 days, bus and taxi operators, ferry service and water taxi service providers. Please be reminded of the stipulated COVID-19 prevention and control measures that are intended to ensure the safety of the traveling public, and by extension, all citizens, given the highly contagious nature of the COVID-19 virus and its variants. For 15-seater buses, you are allowed 9 passengers in the vehicle at any one time. That is 2 passengers evenly spaced per seat, and from what I've been made to understand, there are 4 rows of seats. So that's 8 passengers plus 1 passenger in the front seat away from the driver to allow for social distancing, or 50% of whatever is the normal capacity of your vehicle. Likewise, ferry services are to carry 50% of normal capacity. Operators, please practice and do all you can to enforce the prevention and control measures on your vehicle or vessel. For example, sanitize high-touch areas and seats as often as you possibly can. Have sanitization stations or the necessary products available for passengers to sanitize their hands as well. Insist that all passengers must be wearing their masks correctly, that is, covering their noses and mouths, before entering your bus or vessel, and for the duration of the trip, and that they observe physical distancing guidelines at all times. As far as possible, leave windows open to allow for the free flow of air and maximum ventilation. It is advisable, wherever possible, to take the names and contact numbers of your passengers in case that information is needed for contact tracing. To the traveling public, please ensure that you comply with the prevention and control measures which are intended to ensure your safety. Wear your masks correctly at all times. It would be in your best interest to have spare masks just in case they are needed, and your own hand sanitizing solution so you can apply it every so often while you're out. Observe the social distancing guidelines and stick to to your plan or priority list so you are out and about only for as long as you absolutely need to be. Do not take public or any other form of transport that is crowded or is not observing physical distancing and other COVID prevention and guideline measures or measures or guidelines. The information shared regarding numbers on public transport vehicles applies to the next 2 days of limited operations. That is, tomorrow, Thursday 8th, and the following day, Friday 9th July. For further updates, I invite us all to stay tuned and to follow the briefings over the next few days to be advised about guidelines and protocols post or after lockdown and the possible resumption of more regular and normal operations, most likely starting Monday, 12th July. In the meantime, continue to do all you can to stay safe and to contribute to the safety and protection of your loved ones, friends, and fellow citizens. Remember, nobody is safe until everybody is safe. We must all join the collective effort to reduce and control the spread of COVID and to give our country and federation every chance and opportunity to recover, to be resilient, and to support opportunities for our citizens to earn a living. Ultimately, that is the goal. Thanks for your kind attention. Blessings. Stay safe.
Thank you very much, P.S. Henry Morton. I now to the podium the Permanent Secretary in the Ministry of Social Development and Gender Affairs, Mrs. Janelle Lewis Tafari, who will address us on the Social Assistance Program.
Thank you, Mr. Williams. Good afternoon. As persons are aware, the Ministry of Social Development has been coordinating a food distribution program for households who have been affected by the COVID-19 pandemic. Since we commenced operations on 28 May, 3,814 persons have benefited from the food hampers and hot meals. 346 households who have benefited were in quarantine, and several of these households received packages on more than one occasion due to the length of time of their quarantine period. Another 890 households had members who had either lost their jobs or had reduced income because of the pandemic or the lockdown period. Food hamper delivery will continue tomorrow and Friday. I must point out that non-responses of persons who have applied has been one of our challenges. So I'm asking persons who have applied and have not received your food hamper as yet, if you must leave your home tomorrow and Friday, please keep your phones close at hand, as our drivers will be calling you for directions to your home. In addition to the food hampers, the St. Christopher and Nevis Social Security Board has pledged 1,300 food vouchers to vulnerable households, valued at $200 each. In the past, the figure I would have announced was 1,250. They have since added an additional 50 vouchers, making the total 1,300 food vouchers. Okay. The vouchers will be distributed between St. Kitts and Nevis with an 80-20 split, meaning 1,040 will be for families in St. Kitts and 260 for families in Nevis. The vouchers will be redeemable at Rams Supermarket and Hosford's Value Mart. These two vendors have also pledged to add an additional 10% to the value of the vouchers. A total of 720 names have already been submitted for the voucher program. The names would have been forwarded by the NEMA district management teams. And we expect that these vouchers will be delivered from the Social Security Board by tomorrow. So distribution will commence shortly. We wish to thank all the persons, businesses who have contributed to the food distribution program. It is a long list, so I won't go through everybody, but you can see it on the screen. But there are a few I'd like to point out especially. 869 To Go would have volunteered with us during the lockdown days, and it would have really given us a boost in getting more packages out to persons who would have applied. We've also had the Antioch Baptist Church, who on some occasions provided meals for our team while we were busy packing. The Governor General's office, who helped us with our issue of storage facility for cold stuff. Next slide. Also at the Transportation Subcommittee, so we would have worked closely with Mr. Jason Clark, who has been assigned that committee, who helped us immensely, the Water Department, the Moravian Church, who provided 200 meals for vulnerable families. Real White Entertainment, who we partnered with, the Ministry of Education, school bus drivers, Ministry of Health, and many others who, although their names would not appear here, as some persons prefer to be behind the scenes, but we still want to extend a heartfelt thank you to these persons. Their efforts would have made a difference to the vulnerable families out there. And I have the evidence because we've been receiving voice notes, text messages with persons saying thank you. We've even had one person who called to pray for us. For this initiative, we selected officers who we know to be industrious, committed, and reliable. And these officers have exceeded our expectations. So a special thank you to these officers also. As we prepare for the limited day of operation tomorrow and Friday, before I leave, I must encourage persons. If you must leave your home, please remember to practice social distancing and adhere to all the other recommended methods to prevent further spread of the COVID-19 pandemic in our beloved country. Thank you.
Thank you, Mrs. Lois Tafari. I now invite the Superintendent of Police, Cromwell Henry, to update us on the regulations and the compliance with such.
Thank you very much, Mr. Williams. A pleasant good afternoon to all listening to this broadcast via whatever means. I will begin before I go into the gist of my presentation, I will just read a notice from the Department of Marine Resources. The ministry, the National COVID Task Force and the Commissioner of Police has agreed to some easing of the restrictions on fishers. We know the regulations require fishers only to operate on limited operation days between the hours of 5 a.m. and 6 p.m. And we recognize that that would have put them to a bit of a disadvantage in being able to sell their fish on the Thursday if they're only allowed to go out to fish on that Thursday. And so the National COVID Task Force deliberated on the request from the Department of Marine Resources and have granted approval as follows. Fishers are now allowed to conduct fishing activities between the hours of 5 a.m. and 6 p.m. This is on 24-hour curfew days. And for night fishers, they are permitted to fish between the hours of 6 p.m. and 5 a.m. So the daytime fishers can fish between 5 a.m. and 6 p.m. on 24-hour curfew days. And the night fishers, they are allowed to fish between the hours of 6 p.m.
and 5 a.m. It is required that all fishers notify the Department of Marine Resources or the St. Kitts Nevis Coast Guard before their departure and upon their return to their landing sites. The fishes caught should be taken to the Bass Stay Fisheries or the Bass Stay Fisheries Complex or the Nevis Fisherman Marketing and Supply Cooperative on the days of full lockdown. Fish will not be sold. Fish will not be sold to these. Fish not sold to these institutions should be properly stored by individual fishers and can only be sold on days of limited operation. So the fishers are allowed to ply their trade on the 24-hour curfew days and store their catches at the fisheries complex, either in Charlestown or Bass Stay, or store it themselves, and they can sell to the public on limited operation days. That is on Thursday and Friday. New regulations were published and came into effect at 6:01 p.m. on July 3rd. These regulations will expire at 5 a.m. on Monday, 12th July. The main difference between these new regulations and the previous ones is the standardization of the provisions for both islands, thereby introducing a 24-hour curfew for the island of Nevis. Today is the final day of the 24-hour curfew for this week, and Thursday, July 8th and Friday, July 9th are limited operation days between the hours of 5 a.m. and 6 p.m. Limited operation means a period of limited operation of businesses and enterprises. Regulation 16.2 provides that during a day of limited operation, the following businesses may be allowed to operate: bakeries, supermarkets, pharmacies, private medical facilities and doctors' offices, health centers and vaccination centers, banks and credit unions, motor omnibuses and taxis, gas stations, courier services, and such other businesses as may be approved by the Commissioner of Police. The Commissioner of Police has granted approval for the money transfer businesses and restaurants to operate on this limited operation, these two upcoming limited operation days. However, restaurants may only provide takeout or delivery service. No in-dining will be permitted. Last week, on the limited operation days, hardware stores were permitted to operate due to the impending weather system. This privilege will not be accorded to them this week. So these businesses are expected to be closed on Thursday and Friday. No business or enterprise other than those listed above will be permitted to operate. Bars, barbershops, hair salons, and such other businesses that are not able to operate remotely using virtual means should remain closed. Regulation 15.1 requires all persons while attending any business place to comply with the COVID-19 Prevention and Control Act regarding the wearing of face masks, social and physical distancing, and hygiene protocols. Regulation 16.7 provides that no person shall offer or hire or seek to travel on any omnibus or taxi unless there is not more than two passengers per row of seating. All persons shall wear face masks at all times. The windows remain open or partially open depending on weather conditions, and that all persons shall practice good hand hygiene, proper sanitary behavior, and social distancing protocols. Regulation 16.10 provides that during a day of limited operation, seniors, disabled persons, and essential workers with identification shall be granted priority to enter any business or enterprise. We recommend that a special line be made for these persons so that we don't have both groups mixing in the same line. Regulation 8.9 provides that during a day of limited operation, all businesses and enterprises shall operate in such a manner as to ensure that the opening and closing hours allow sufficient time for all personnel to adhere to the hours set for night curfew. Night curfew begins at 6 p.m. Most of the larger businesses closes at 4 p.m. and so this is a good time, and we recommend no later than 5 p.m. as the closing hour for businesses. In closing, I wish to appeal to every person to be responsible in your actions tomorrow. If you are in quarantine or isolation, please honor the conditions of your quarantine or isolation and stay at home. If you are not in quarantine or isolation and is able to access any of the services or businesses that are open, please avoid overcrowding and observe all the COVID-19 protocols of which we are all aware. Thank you.
Thank you, Superintendent Henry. I now invite Dr. Marissa Carty, who is the Public Relations Officer at the Health Emergency Operations Committee. Dr. Carty.
Thank you, Mr. Williams, and a pleasant good evening to all listening. This evening, I present the Health Emergency Operating Committee Situation Report for Wednesday, July 7th. The Federation of St. Kitts and Nevis continues its fight against the COVID-19 virus. Over the past 6 weeks, we have seen an increase of 472 confirmed cases, during which we have seen 273 persons recovered. There are currently 196 active cases with 5 hospitalizations and 3 COVID-19 related deaths. This map gives an indication of the areas in St. Kitts most affected by this recent wave. It is important to note that the darker areas represent a higher incidence of cases and that these areas also correspond to the more densely populated areas on the island. Therefore, in summary, the Federation records a total of 517 confirmed cases of COVID-19, with 499 cases in St. Kitts and 18 cases in Nevis. 318 cases have fully recovered, and as mentioned previously, we now have 196 active cases, 5 hospitalizations, and 3 COVID-19 related deaths. The situation in Her Majesty's Prison continues to improve. A total of 55 inmates were impacted, of which 39 are now fully recovered. There are currently 16 active cases in the prison. The prison staff has also been affected. There were 12 confirmed cases among the staff. 2 have since recovered, and there are 10 active cases among the prison staff. The variant currently in circulation in the Federation is the Lambda variant, which was first identified in Peru and has since spread to 29 countries, most of which are the South American countries. Research is now confirming that this variant is more transmissible. Our contact tracing efforts continue. Thus far, 2,494 persons have been interviewed, 2,002 persons have been released from self-quarantine, and there are 492 persons remaining in self-quarantine. We also continue our COVID-19 testing on both suspected cases and their contacts. We are also engaging in targeted and random testing in various communities. The last batch of vaccines expired on Wednesday, 30th June, and brought the first phase of the vaccine program to an end. By end of day, June 30th, 69.4% of the target population had received their first dose, and 57.2% of the target population had received their second dose. The vaccination program continues tomorrow, Thursday, July 8th. Persons who have received their first dose, next slide please, of the vaccine between June 3rd and June 30th would have received a 12-week appointment. As stated before, the recommended interval between doses is 1 month or 4 weeks to 12 weeks. Therefore, persons can return for their second dose once 4 weeks or more have elapsed since receiving their first dose. Please note that the current batch of vaccines will expire on August 30th. We continue to encourage persons to adhere to the COVID-19 protective measures and behaviors, which includes sheltering in place during this lockdown period, wearing a face mask appropriately covering both your nose and your mouth, sanitizing your hands with soap and water and/or an alcohol-based hand sanitizer, maintaining a safe distance of 6 feet or more from persons with whom you interact, and boost your immune system by taking your vitamins regularly, eating healthy, exercising, and getting enough rest. We are all encouraged to work together, doing our part to reduce the impact of this disease. Remember, maintaining the overall health of the people of St. Kitts and Nevis continues to be our individual and collective responsibility. Stay safe, stay healthy. I thank you.
Thank you very much, Dr. Carty. I now invite Mr. Abdias Samuel, the Chair of the National COVID-19 Task Force and the National Disaster Coordinator here at NEMA, to give us his presentation. Mr. Samuel.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone listening and watching via all various means. First, I want to start this presentation by expressing solidarity with the St. Kitts Nevis Haitian Association, and to let you know that we stand with you and your people as you go through your time of grief on the passing of the President of Haiti and the injuries sustained by the First Lady there in Haiti. And I also want to express solidarity with the people of Grenada who would have suffered from the impacts of Elsa, with flood damage, St. Vincent and the Grenadines, who would have had a number of house roof blown off, the people of St. Lucia, who would have experienced the same, and also with the people of Barbados, who have actually received significant damage from the passage of Hurricane Elsa. I also want to extend solidarity with the people of Cuba, who would have been ravaged by the passage of Hurricane Elsa. Our prayers and thoughts are with you. I want to also take this opportunity to thank a number of healthcare professionals based on my experience today. I would have been in the hospital with my mother from about 10 a.m. this morning till just a while ago, and I must commend the professionalism exercised by Dr. Isaac, Dr. Blanco, Nurse Tyson, and Nurse Fraser. I think sometimes we don't appreciate the hard work that some of these institutional healthcare professionals do at times. And for your efforts today, I want to say thank you publicly. Ladies and gentlemen, we would have had, meaning the COVID-19 task force would have convened a multi-stakeholders meeting on July 6th, 2021. And in this meeting, we would have had participation from all sectors of our society, and a number of measures that are going to be deliberated upon, and hopefully they will be approved or discussed. However, prior to that, on the 5th of July, the National COVID-19 Task Force would have had a discussion. And this discussion, we looked at the various sectors in society as per the reopening of our economy and the country on a whole, and bringing the country to a state of normalcy. Let me just outline to you per sector some of the recommendations, general recommendations that were discussed among the membership in consultation with a number of stakeholders. We look at public transport. We look at land and sea, because we know the air side of it is open and is functional. We look at the bus, taxi operators, at what percentage of capacity, or at what capacity, do they begin to function in a phased approach. We also look at the ferries, water taxis, and at what capacity they should function. We look at the business sector in terms of the opening hours. Should we continue with curfews? How do we continue with a phased approach to a number of these sectors? Encouraging e-commerce, looking at digital transformation as the way forward to help us build resilience, because the reality is that we have to live with this virus going forward. We also look at the discussion of vendors remaining in the public market. We look at the situation of farmers and fishers, adopting programs that will help them to be resilient. We also look at the policy of persons working remotely and the capacity that should be permissible for persons to return to offices. And we look at the policy for the vaccination for businesses to continue to, advocate for vaccination, and also the continuing education programs for these businesses. We also look at the construction sector, and looking at opening of the hardware stores so that construction can begin, and how this construction sector can do their trade or apply the trade in a very safe manner. We were happy with the religious sector because they have been conforming with the protocols and procedures, and there was much really that we can actually advocate for, but for them to continue doing what they were doing. We also look at the education sector, the protocols and the document that have been developed by the Ministry of Education in consultation with the Ministry of Health and other stakeholders such as the task force, National COVID-19 Task Force. And we also encourage the reopening of nurseries and daycares with strict protocols. Let me just mention something for the business sector. For the business sector, we also discuss stiff penalties for those who are not conforming to the protocols. For example, a ticketing system. Rather than taking you to court right away, have a ticketing system, and by extension then, if it reached to the point of taking them to court, then we should do so. We also look at the tourism sector, the opening of beach bars and restaurants. We look at the opening of restaurants and bars in general, and also the return of the cruise industry. That is priority for us. We would love to see the tourism sector become alive and highly competitive and one of the best in the region, and we are looking at these sectors. We are hoping that the stayover tourist or guest that will increase as well, and that is why some recommendations are on the table for the reduction of the quarantine period. We also looked at the entertainment sector, limiting the limited activities of fetes and subjecting persons to a number of protocols. encouraging the vaccination process, looking at non-vaccinated, and also ensuring that there are caps in a phased approach to activities. We looked at the manufacturing sector. We were pleased by the approach that was taken by the manufacturers themselves. We would have met on the 5th with the manufacturing sector as well, and they themselves rolled out their plan in how they wish to open, and that was commendable. I want to commend Cajola Cristado, Java Electronics, and API Harosovo. They were excellent in delivering their roadmap to recovery plan to us in terms of reopening. And to them, we commend them. We also look at the financial sector, the banks, those institutions that do send money and deal with remittances, etc., and the safe operations, because we know there's a sector of society that actually depends on these sectors, so we want to ensure that we build resilience within these sectors. We also look at the sporting sector and the resumption of sports, major events within the sporting sector. We know that we are looking forward for CPL, that should begin next year. And also we know that we have the football, basketball, and cricket, volleyball, amongst many other sports that are played at high levels. We also look at the public sector and ensuring that we have so that the public sector in itself mirrors what is being demanded of the private sector. However, for us to do this, we have to ensure that there is major compliance. For example, the COVID-19 compliance teams, the police, health inspectors, and others will have to carry out more robust inspections of businesses and also enforce these protocols. Within the entertainment sector, we looked at also the gaming sector, the casinos. We have a number of casinos, and we know that these casinos do provide a level of entertainment as well. So these are being looked at, and hopefully by next week, we should see some form of reopening. Let me just say to you, general public and everyone viewing, that I think we are at a level that we are satisfied. We do understand that we have to live with this virus. And the reality is that you have to adapt. We have to now adapt to live with this. This should be, and I want to caution myself in saying this, but should be our last 24-hour lockdown. Maybe we could have restrictions if we see clusters, but if we look around the world, we can see. Look at the UK, what they have done. Barbados has done similar, and we are looking at the best practice throughout the Caribbean region and by extension, the whole world. With that said, I want to thank a number of individuals who have made our work a little easier. The hotels who have made a significant sacrifice to keep their staff in-house so that they won't have to be traversing back and forth from the place of abode to the place of work, and minimizing the risk of bringing in the virus to the institution. The taxi operators who came out on full lockdown days to ensure that they service the incoming flights. The port workers who processed anyone coming into our countries. But most importantly, my highest recommendation goes to the general public and the disciplineship we have seen. The 1 or 2 incidents reported here and there, these are something that are acceptable. They fall within the plus or minus margin that we expected, but overall we have had a wonderful response from the general public, and of course, the frontline workers who came out on a daily basis to perform their duties. You didn't see no much sick out, you didn't see no much complaining. Persons came and they performed the national duties as was expected. The limited days of operations, the 8th and the 9th of July, will be critical periods. I am certain, just like I am, you feel rather restricted by the lockdown. This is something I don't wish to experience again. And if you want to do your part, tomorrow exercise the necessary discipline required and the lines. When you go to the lines, keep your distances, continue to wear your mask, sanitize. And if you see someone who is breaking the protocol, simply advise them to follow the protocols. When you're traversing on the public transportation, exercise caution. Again, I am going to make an appeal that if you have a large household and you only need to shop, please let one person from your household go do the shopping if necessary and come back. If you have your own vehicle, utilize your own vehicle and avoid public transportation. I also want to acknowledge a group from Nevis in Miami. They have communicated that they have carried out a fundraiser exercise in Miami. They have packed a container full of food, and they will be donating this container full of food through NEMA for the general public. This exercise will be executed again by social services. So as soon as this container reaches here, we are going to continue to support our social protection programs that are in place. So P.S. Lewis has been placed on high alert with this and in this regard. So I have outlined to you what the discussions are, and I know some of you want to know what is happening on Monday. Are we opening on Monday? Well, please tune in tomorrow to the Prime Minister's press conference, and we will communicate to you. I'm not committing that you will hear it tomorrow, but it will be important for you to tune in, as he's the actually chief. He's the commandant and chief, and he will be the one to inform the general public and the country on these procedures. So please tune in tomorrow to the Prime Minister's press conference right here at NEMA and ZIZ and all the other major radio stations, and listen for the announcements. So thank you again, and we now look forward for your questions.
Thank you very much, Mr. Samuel. That brings us to the question and answer segment. And the first question has to do with the Lambda variant. It has been reported that the Lambda variant, which we have here in the Federation, might be vaccine resistant. What do the doctors in the room have to say in terms of that piece of information? Any update on that?
We know that the Lambda variant is more transmissible, and any virus that is more transmissible, you would have a greater incidence of the disease, and if you have a greater incidence of the disease, you could have a greater mortality. With that said, in South America, it is found that the Sinovac vaccine that they've been using down there has not been as effective against the Lambda variant as it relates to mild disease. The jury is still out as it relates to the other vaccines. And so for now, the vaccine that we have is safe and effective.
Thank you, Dr. Wilkinson. What measures have been put in place to ensure that persons in home isolation stay in place? Superintendent. The person prefaced your report from the last New York briefing, where you said that there were persons who were supposed to be in isolation, but they were seen in lines or in town shopping.
We have been appealing to people's good judgment in honoring the conditions of their quarantine. They are told when they're placed in quarantine that the main condition is that they remain at home and do not go out in public. If they need assistance, they have numbers where they can call. For those who are positive, they have case managers. Those who are in quarantine, they have the 311 number. They're given the social assistance numbers where they could call if they need that assistance. And so we appeal to their good judgment to honor that and respect that condition. Given the numbers, we cannot have security at each person's home. It's just too many persons. And so we have to rely on persons' good judgment and continue to appeal. From time to time, the compliance team would make checks. We rely also on persons in the neighborhood who may be aware of their condition and would call and report. But we continue to appeal to persons' good judgment and sense of responsibility to respect the terms of your quarantine and respect other person's health. If you are infected and you go out in public, you are putting the public at risk. And so we hope that persons would not want to do that and to stay at home when you're told to stay at home by the health authorities.
I just want to make a correction to what Mr. Samuel said with respect to the Caribbean Premier League, what is known as the CPL. He said next year. However, it is this year. It should have been next month and not next year. Had some people there quite alarmed. This question is from SKN Newsline, from Glenn Bart. It is now understood that Florida State will allow unvaccinated persons to board cruise lines, and cruise companies could face stiff fines even for questioning passengers on their vaccination status. Will we be allowing unvaccinated cruise activity in St. Kitts and Nevis, given the fact that there are variants of COVID-19 that have been proven to be highly transmissible?
To be quite honest, I'm not surprised that that question came up. I know that quite some discussion has been taking place about whether or not we are going to allow unvaccinated cruise passengers to disembark in St. Kitts. I think that that discussion is still taking place. We're leaving it in the hands of the health authorities and all of those other persons who are charged with that level of responsibility to have that discussion about whether or not we are in a position to take that risk. So I think that the jury is still out on that. As far as I am aware, I don't know of any definite answer where that particular question is concerned, to be quite honest. But I'm hoping that we would have an answer pretty soon, because we know that cruising has already begun coming out of the US. And so it is in our best interest to have a definitive answer within short order.
This question is from WinFM 98.9. Can you address the allegations that case number 18 on Nevis was a false positive?
We had no false positive in Nevis.
This next question is that we are now in the second week of lockdown. What are the daily additions to quarantine? I guess not daily additions, but how many persons do we have in quarantine?
Very good question, Mr. Williams. So yesterday, we added 2 positive cases to our tally. That's yesterday, Tuesday. On Monday, we added 23 positive cases to our tally. So each day, the contact tracing team would interact with these newly diagnosed positive cases, get the list of their contacts, and then the contacts would be placed in quarantine. And so the number of persons added to the quarantine list depends on the number of positive cases we add on a daily basis. So it varies from day to day. So at present, the contact tracing team would have interacted with almost 2,600 individuals, and I think we have almost 500 persons still remaining in quarantine. That's an approximate number.
Superintendent Henry is asking, said that seniors can go to the top of the lines. Somebody is inquiring, who is a senior?
By Social Security, I'm advised that that age is 62 years, persons who are 62 and over. That is the retirement age for Social Security. So persons who are 62 and over, they're considered senior citizens. If you have a card, you may have a senior citizen's card, or you may have some other form of ID that to verify your age, and those persons should be given preference in any line at any establishment.
CMO One Radio wants to know or wants an update on the persons that are hospitalized, if they're doing well, if they're recuperating, how are they coming along? A general.
All right, so very good question, Mr. Williams. So at present, we have approximately 5 individuals admitted to the COVID ward at the JNF General Hospital. They are based on my last conversation with the matron. She isn't particularly perturbed about any of the 5 cases, but I would add that of the 196 active cases that are being monitored, each active case or each individual diagnosed with COVID is assigned a case manager. And the case manager is a senior nurse, and she's supported by a team of physicians, and they interact and engage the individual who is diagnosed with COVID on a daily basis. They make sure they have all the pertinent information about that individual, any underlying comorbidities, for example, diabetes, asthma. The purpose of the case manager is to ensure that they have all the regular medication for their underlying conditions, and their role is to ensure that the individual remains stable, and if there are any symptoms of concern, that individual probably is transferred to the hospital, to the emergency room for stabilization, for biomarkers, x-rays, tests. Once stable, they are transferred back home. Those who require hospitalization are hospitalized. And so we have a team of individuals following up all the cases closely.
Thank you, CMO. Someone is asking for some clarification. Is P.S. Lois here or she has left? Right. some clarification with respect to the voucher distribution between the two islands.
It will be a total of 1,300 vouchers, and because the St. Christopher and Nevis Social Security Board serves both islands, there had to be a split between St. Kitts and Nevis for voucher distribution. So the split that they decided upon was an 80-20 split. So 80% of the vouchers will be for families in St. Kitts, and 20% of the vouchers will go to families in Nevis. So once the vouchers are prepared and ready for distribution, the NEMA district teams would have been the ones to identify the persons who were eligible for the vouchers, will be the ones to distribute or deliver the vouchers to the households. The households will then have up to 3 months to go and visit the supermarket and to redeem their vouchers. When they go to redeem the vouchers, they would have to walk with an ID, so that they have proof that this is the person who the voucher belongs to. The supermarkets will add an extra 10% to the value of the voucher.
Thank you, P.S. Lewis, for that clarification. I want to read this. It's not a question, but it's a commendation. I would like to express heartfelt thanks to P.S. Janelle Lewis Tafari and her hard-working staff at the Department of Social Services. The food and care packages are amazing. The sacrifices made during this time are commendable, and the persons they have served, like myself, are forever grateful. Kudos to all who continue to play a part in this rewarding endeavor. It's always good to get the positive. Sometimes you get so many negatives. Sometimes some people are only positive in the negative. Dr. Wilkinson, this question is for you from WinFM. Is case number 18 still in the Federation?
Let me just give a little longer answer. When persons are leaving the Federation, they are tested, and if the test positive, they have serial testing until they return negative tests, and then they're cleared. Case number 18 was cleared and is no longer in the Federation.
Okay, that brings us to the end of our questions for our press briefing today. I want to thank you for posing your questions and hope that they were answered satisfactorily. Thank you very much. I want to thank all of the presenters today. We start with Mr. Philip Brown, who is the director of the Small Business Center, the Small Business, there's something else, it's SBDC. So it's a Small Business Development Center. We thank P.S. Carleen Henry Morton, who is here today in the capacity of, as the chairperson of the Transport Board. We thank P.S. Janelle Lewis Tafari, the permanent secretary in the Ministry of Social Development and Gender Affairs. We thank the Chief Medical Officer and Dr. Hazel Laws, and we thank Dr. Marissa Carty for presenting today the Health Emergency Operations Committee Situation Report. We thank Dr. Cameron Wilkinson, the Medical Chief of Staff at the JNF General Hospital for always being here and availing himself to answer any questions that are asked. We thank Mrs. Christmas Jacobs for her service of sign language. We thank Mr. Abdias Samuel, Chair of the National COVID-19 Task Force and NDC at NEMA. And we continue to thank the media for partnering with us. We also thank the Minister of Health, who is here today, the Honorable Akila Byron Nisbet, and the co-chair of the Disaster Mitigation Council, the Honorable Wendy Phipps. Thank you to all of you. We will be back at some other point for our press briefing. Until then, take good care. I am Les Roy Williams.